I take this opportunity to welcome you all on behalf of Hetero Healthcare. My name is Sandeep Patil, Regional Manager for Maharashtra. First off, thanking for joining us today. Discuss on Ciprazet, a novel antipsychotic Cariprazine. As you know about Hetero Healthcare, we are the largest R&D wings with having a 360-degree solution provider. More than 25 years of excellence in multiple therapies. Currently present in more than 126 countries worldwide. More than 200 products across various therapeutic categories such as HIV, AIDS, oncology, cardiovascular, neurology. Distinction of bringing 4 biosimilar products to market, 36 plus state-of-art manufacturing facilities. We are the pioneers in quality and innovation. Today we have a Dr. Mahesh Bhirud. Sir is a MD psychiatrist currently practicing in Nasik. Sir has MD psychological medicine from Lokmanya Tilak Medical College, Sion Hospital, Mumbai. Practicing since 2007. Sir has presented his paper on suicide, alcoholic, etc. And sir is dealing with psychiatric disorder, de-addiction, sexual disorder, counseling, stress management, and sleep disorders. Sir, over to you, sir.
Afternoon, everyone. I hope everyone is doing well, and I hope everyone will listen to this topic. Maybe I won't make anyone sleep. Let us see. Today's topic of discussion is Cariprazine. Now, Cariprazine is no more a newer molecule because many of us might have got sufficient exposure and experience of using Cariprazine in different kinds of patients. Basically, Cariprazine is indicated in schizophrenia and bipolar mood disorder. So even the initial 2 slides of the presentation mention various symptoms of schizophrenia and mood disorders, like some positive, negative cognitive symptoms and certain mood symptoms like depression and mania. If we look back into the history of antipsychotics, early success in the treatment of psychosis or psychotic symptoms was initiated by discovery of first generation antipsychotics. We call them major tranquilizers. And we all know that these first generation antipsychotics basically work by blocking D2 receptors. While they are mainly effective against these positive symptoms of schizophrenia, they are commonly associated with certain unwanted effects. Mainly if we talk about extrapyramidal symptoms like tremors or rigidity. In later days, in the mid-90s, second generation antipsychotics were introduced. Basically, dopamine blocking agents are first generation, and along with dopamine blocking, those acting on serotonin receptors are the second generation or atypical antipsychotics, what we call them. So they have minimal risk or lower risk of causing extrapyramidal reaction. So with the invent of these atypical antipsychotics, they largely replaced these conventional agents for the treatment of schizophrenia. But still, the challenging factors are about treatment of negative symptoms or cognitive symptoms. And these second generation antipsychotics are still associated with some degree of extrapyramidal reaction too. Again, to talk about other undesirable side effects associated with these atypicals are weight gain, then metabolic syndromes and cardiovascular unwanted effects. So there is a need of a novel kind of antipsychotics, and these atypical antipsychotic agents with novel D2 receptor partial agonist pharmacology, we can say, are invented, and in today's language we call them third generation antipsychotics.
Sir, sorry to interrupt you. I am sharing slides for you. If you need anything, please let me know, sir. I am sharing the slides.
Okay, you can slowly keep rolling them.
प्ले बटन दबा दे.
हाँ.
Now I am talking about fifth or sixth slide. So this D2 receptor partial agonism, it behaves as a functional antagonism in mesolimbic dopamine pathway, where basically in schizophrenia, hyperdopaminergic activity is thought to cause positive symptoms, while this functional agonism in mesocortical pathway, where hypodopaminergic activity is thought to cause negative symptoms or cognitive dysfunction. So we need certain agents which can address both these positive and negative symptoms. And you all might be aware that before Cariprazine, we were quietly using aripiprazole, which has other distinguishing features from typical antipsychotics, like agonism activity on D2, D3, and serotonergic receptors. In this class, Cariprazine, I think, is the most recent member with distinct antipsychotic properties. Mainly D3 preferring activity means it has more kind of D3 affinity than D2 partial agonism, along with serotonin partial agonism. So comparing both Cariprazine and aripiprazole, they are both partial agonists at D2 and D3 receptors. Still, Cariprazine is ahead in terms of D3 affinity because it has greater potential for agonism at D3 receptors. Again, when a psychotic patient comes for consultation, multiple antipsychotics are available for treating psychotic symptoms. And really, it becomes a kind of challengeable task for a psychiatrist to choose right antipsychotic for whatever symptoms the patient presents in front of you. So it is more sensible to consider characters or the properties of individual antipsychotics while choosing a specific drug for those kind of symptoms. Antipsychotics differ markedly with respect to their side effect profiles, and on the another side of the coin, patients too differ in the side effects they are and are not willing to tolerate. We see many people, they tolerate very easily minor kind of unwanted effects and they don't complain about them. But some patients, they do complain a lot, or we can say overemphasize these kind of unwanted effects, even on minor doses of medicines. So it is therefore important that patient should be involved in the choice of antipsychotic drug. Cariprazine is basically indicated in wide spectrum of symptoms and can be used in younger patients with first episode of psychosis, patients having predominant negative symptoms, and those prone for or with metabolic syndrome. FDA has specially approved this Cariprazine for indications like schizophrenia, bipolar mood disorder, specifically bipolar depression and major depressive disorder in 2015. How does it work? This D3 receptor subtype is the main characterizing feature, and Cariprazine is more effective in negative symptoms than the previously used typical D2 receptor antagonist. Basically, it was developed on the same basis or the same hypothesis that although D2 affinity is antipsychotic property of antipsychotics, D3 antagonism or partial agonism may provide additional benefit in the treatment of schizophrenia. Based on this hypothesis, Cariprazine was. Its efficacy may be mediated through a combination of partial agonist activity at D2 and serotonin receptors and antagonistic activity at serotonin 2A receptors. It is basically partial agonist at D2 and serotonin 1, whereas antagonist at serotonin 2 receptors. It also demonstrates partial agonist activity at D3 receptors. And what makes it different from other antipsychotics or other even third generation antipsychotics is it exhibits approximately 3 to 10 fold higher binding affinity at D3 compared to D2 receptors. Means it's written in few books also that it has more affinity for D3 even than whatever dopamine present naturally in the brain. Along with that, it exhibits moderate to low affinity for histamine, serotonin C, and alpha 1A adrenergic receptors. And to mention, it has no appreciable affinity for muscarinic receptors. Talking about pharmacokinetics, peak plasma concentrations can be achieved in 3 to 6 hours after oral administration. And the main metabolites of Cariprazine are DCAR, dismethyl cariprazine, and di-dismethyl cariprazine. So these mean steady concentrations of Cariprazine and its metabolites can be achieved within 1 to 2 weeks. It may vary from patient to patient. These principal active metabolites are present at mean plasma concentrations. For example, approximately 30 to 400% of plasma Cariprazine concentrations even after 12 weeks. So again, Cariprazine and its principal active metabolites are almost highly protein bound, and it is mainly metabolized by CYP3A4 and to certain extent with CYP2D6. It is excreted in urine, and half-life of cariprazine can be mentioned for 2 to 4 days, and active metabolites approximately 1 to 3 weeks. This is all about talking of all about cariprazine. I searched for a few reviews of the patients. So this is all observations which are made by scientific studies. Whatever observations and experiences we get in terms of symptom control according to our rating scales and questionnaires. On some websites, reviews about patient rating is also available. So some interesting things I found there, and cariprazine has an average rating of 6.1 out of 10, which seems to be good from total more than 500 reviews on one site, that is drugs.com, of which 51% of the reviewers reported positive experience, while 33% reported negative experiences. A reviewer who rated almost 10 of the 10, he says previously he was skeptical about this medicine, and he is taking cariprazine since 3 weeks and has never felt such better life previously. So literally he writes, finally I feel alive. I think this sentence says everything. At first he had some serious nausea, and which lasted for a few weeks, and he felt no negative side effect. He says, if you are at the point where you think your life is over, as you no longer have a purpose, and you feel as if you have completely given up, please give this a try. It has changed my life and my family's life. This was worth 10 years of suffering. I have finally found a medicine that works for me. This was one review, and on the another extreme, one reviewer who rated 1 of 10 only. He said, at first I was happy to have depression lifted and be motivated to do things, and finally not avoid, means to be able to face tasks. But 4 a.m. every day, I am not tired but not settled. It's not a calm feeling but a manic one. It has made me more angry, and I struggle controlling my emotions and attention span. And this has made it worse. I actually felt violent urges. That's it for me. I will never take this again. The lack of joy, the cold clinical feelings I have. How irresponsible that not one of these side effects were explained to me. So whatever. So some can experience good, some may experience bad. So as initially we talked about side effect profile, patients may also differ from. We need to make a best choice for the symptoms which are presented in front of us. I would like to share certain experiences of mine, like in a case of 45-year-old male who was suffering from bipolar mood disorder, and he had multiple episodes of mania, 4 to 5 episodes, and he had visited many consultants also in the past. So when he first approached me, he revealed all these mood stabilizers and all other medicines. And he said now he has fed up with using these kind of medicines and he wants certain new medicine. So guidelines say to use mood stabilizers in such kind of patients, but he was not ready to take any kind of drugs he had used in the past. So he was initiated with Cariprazine and he never had tried Cariprazine before. So Cariprazine was initiated with 3 milligram and gradually increased to 6 milligram. And to surprise, he is stable since last 1 year on 6 milligram of Cariprazine. And till now, he has not got any kind of mood fluctuation or switches. Another patient, 30 years old female, she had predominantly negative symptoms. And these kinds of patients, especially females, suffering from negative symptoms, when they do not help in household work, families experience more burnout kind of syndrome with kinds of female who do not take part in household works and do not become a kind of helping hand for other women in the family. Along with other symptoms, she had mainly negative symptoms like lack of motivation, emotional numbness, or she had poverty of speech too. She was hardly communicable, and she would not help in the household work. She was put on Cariprazine, 3 milligram, and relatively good improvement she has showed since Cariprazine is added in her prescription. So it is a positive experience about Cariprazine. One more patient I remember about who had a bipolar depression when he came to me, but in his past history, it was seen that whenever he would go in depression, his depression would not be lifted with mood stabilizers or even lamotrigine. So some low dose antidepressant has to be used that time, and he would switch to mania. And in the phase of mania, risperidone or similar antipsychotics needed to be used to calm him down again. But again, with the use of lower dose of antipsychotic, he would exhibit depressive symptoms within few days, and the cycle would go on. After adding Cariprazine, just 1.5 milligram along with lithium, he is stable without any further mood fluctuations in his symptoms. So I can say all these evidence suggest that Cariprazine may offer some kind of broad spectrum efficacy advantages for schizophrenia and bipolar patients. Schizophrenia, especially negative and cognitive symptomatology, and may be helpful for functional improvement, what nowadays is the criteria for remission. So not only symptoms should be improved, but there should be functional improvement to the baseline level. So Cariprazine may offer broad spectrum efficacy for these kinds of patients. Even these various kinds of clinical trials which are mentioned in the slide compared to risperidone, compared to placebo, compared to aripiprazole, they have shown better results in improving positive as well as negative symptoms in the PANS, and along with that, global improvement scales are also favorable. So I think cariprazine stays as a promising molecule among the various molecules which are introduced in recent years. So that's all from my side. Thank you.
Yeah, thank you, sir. Sir, we are having some couple of questions which are asked by the audience.
Okay.
If you allow, we can take one by one.
Yeah, sure.
Yes, sir. The first question is from Dr. Rajesh. It is how we differentiate in terms of side effect profile aripiprazole versus cariprazine.
Talking about aripiprazole and cariprazine, both are kind of atypical antipsychotics, but as we discussed, it has more kind of D3 affinity than aripiprazole. In terms of unwanted effects, we see akathisia as commonly associated with both of them. Again, few patients experience sleep disturbances with both of them. Nausea, I think till now no one has complained about aripiprazole, but it is there with cariprazine in some patients. So maybe GI disturbances are more commonly associated with cariprazine than aripiprazole. And as I said, both of them, they share common receptors affinity. So maybe may not be too much differences related to the unwanted effects also.
The next question is related to your answer only. How to avoid akathisia?
Okay. Basically, if the patient is suffering from akathisia, the first choice would be to lower the dose of antipsychotic, whatever we are using. Second option may be switching to another one. And third option, if the patient has got better response on the antipsychotic and there is no other choice, then you can add propranolol or in lower doses atizolam or clobazam that can help in reducing symptoms of akathisia.
Yes, sir. Sir, next question is in MDD, which antidepressant is suitable with cariprazine?
This is mainly related to the pharmacokinetics. As we said, cariprazine is mainly metabolized by CYP3A4 and to a lesser extent 2D6. So almost all the antidepressants also fall in the same category. So there is nothing specific like this antidepressant is well tolerated with cariprazine. But according to the patient profile, I think you can choose any SSRI or SNRI. But again, do remember about these pharmacokinetic properties. There is no special recommendation about using specific antidepressant.
Okay, sir. Sir, next question is any sexual side effects seen with cariprazine?
It is another advantage of using cariprazine because people suffering from schizophrenia on cariprazine has not reported any kind of sexual side effects similar to aripiprazole. So till now, though the literature mentions certain kind of disturbances in desire and erectile dysfunction.
Okay, sir. Sir, Dr. Rajesh is asking, how do you see cariprazine as a molecule in treatment of psychotic symptoms?
As I said, cariprazine can be seen as a promising agent among various novel antipsychotics which came into market recently because of its efficacy and safety and tolerability profile. So it is a typical antipsychotic, can be used safely in patients who do not complain of akathisia in the initial few days. So can be started with lower doses and gradually increased till desirable effects. So it is a good molecule, I think.
Yes, sir. Very next question is, in treatment-resistant depression, cariprazine alone add-on which antidepressant works well?
I think we discussed the same thing in the previous question also. There is no specific recommendation about specific antidepressant. Again, as we choose antipsychotic depending on the unwanted profile, side effects profile. Similarly, you can choose any antidepressant with favorable side effect profile, and do remember about these pharmacokinetics and CYP2D6, CYP3A4 mainly. I hope this may answer the question.
Yes, sir. No more questions are there, sir. Sir, one more question, as you have said that in patient you have tried where you found this molecule even better than lamotrigine, where the lamotrigine have not worked. Patient who are having a bipolar depression. So, sir, what dose you have, like, how was your experience when you compared with the lamotrigine with this molecule?
About that patient, so whenever that patient would switch to mania, lower dose of atypical antipsychotics were used, and after some time, the patient would experience depressive symptoms. So what we can call neuroleptic dysphoria. If none of the medicines were used, only typical mood stabilizer like lithium, his depressive symptoms would not be lifted. So needed to be added some kind of another mood stabilizer which has promising antidepressant activity like lamotrigine. So even up to 50 milligram of lamotrigine, the patient would experience switch to mania after few days, and this cycle would go on. Means there was no point of using antidepressant because you would definitely experience many switches on antidepressants. Lamotrigine was a better choice. So antipsychotic and lamotrigine, so he would shuffle in between manic and depressive symptoms. So considering all these cycles, instead of lamotrigine, cariprazine was used in his depressive phase, 1.5 milligram. And he felt well. Means he came to euthymic level after a few days, and he did not have manic switch to. And because of cariprazine, a kind of antipsychotic, he didn't have depressive symptoms also after few days. So I think it become a better choice for this kind of patient.
Thank you, sir. Now, no more questions are there in my inbox. So, thank you, sir. Thank you for sharing your personal experience with this molecule. And I hope this will be definitely helping the entire audience and building their confidence level in the molecule. So, thank you very much, sir. Thank you for giving your valuable time and guidance for the entire team. Thank you, sir. Thank you.
Thanks a lot, sir. It was a wonderful presentations, and we have a lot of learnings with your experience. Thanks a lot, sir. Thank you so much.